So, everyone has interacted with some aspect of healthcare at one point or another in their lives, probably with some positive and some negative experiences. As a result, today, my group and I would like to talk about the healthcare industry and Beth Israel Deaconess Medical Center, and more specifically about how one could implement lean. I will begin by explaining some key ideas about the healthcare industry. The American healthcare system is one of the largest, fastest growing, most complex, and most important industries today. Last year, there were more than 16 million people employed and more than 36.5 million patients admitted to hospitals in the U.S. Additionally, the healthcare industry is very complex. There are many different sectors of work and many main players, such as the health providers, payers, management, and so on, who are all needed to meet the health needs of its patients. As a result, value in this patient-focused system can be difficult to maintain and waste can easily hide. Additionally, the demands of customers and patients in healthcare are rapidly and constantly changing, for example, due to the rapid rate of growth in addition to the aging population and rising costs of healthcare. These growths will eventually and very quickly become unsustainable, requiring actions of change from the healthcare industry in order to improve the quality of healthcare.
As Aileen said, the growing size and complexity of the healthcare industry causes many challenges. For example, there is a lack of communication between providers from different sectors, meaning that if two different providers who are being paid by two different entities are providing care for the same patient, it may be difficult to communicate the needs of that patient to one another. In the healthcare industry and specifically hospitals, we also see provider shortages as well as limited finances. If employee satisfaction and communication could be improved, hospitals can keep their doors open financially and provide safe and quality care to patients in an efficient manner.
There has been a lot of improvements in the medical industry in terms of lean in the last 10 years. One new development that has become common practice is having daily huddles and metric boards. These help employees all stay on the same page and also facilitate continuous improvement. Beth Israel began implementing their version of this, called Daily Management System, or DMS, in 2013 and has been improving and mastering the program ever since. DMS has helped nurses feel valued and heard and has improved various nurse processes drastically. An important lesson taken from this is that although we are striving for perfection, you cannot let that get in the way of small, good changes. Knowing that a change will not fix all problems is all right, it does not mean that it will not still bring value to the process. Next steps for DMS involve continuing to roll this out to all units, as it is currently at only 27 units.
In the hospital setting, there are several forms of waste that can be removed through lean implementation. An example of this is the waste of time, which can be seen through patient waiting times, as well as the waiting time for patient care service employees between appointments. In hospitals, the non-utilization of talent and unnecessary emotion by employees are also apparent. When combined, all of these separate types of waste cause the patient care teams to be overworked, and this leads to employee burnout and a decrease in both patient and employee satisfaction.
For the company that we were going to study within our industry, we chose Beth Israel Deaconess Medical Center because I had a former co-op there and I had resources there that could help us get our questions answered. Beth Israel Deaconess Medical Center is one of the premier hospitals in Massachusetts. It has over 10,000 employees just at its Boston location and has multiple satellite locations around Massachusetts. Although qualifying other hospitals as competitors is not exactly the way it should be seen, the other major hospitals in the area are Massachusetts General Hospital, Brigham and Women's Hospital, Boston Medical Center, and Boston Children's Hospital. Beth Israel has seen a tremendous amount of growth over the last few decades and just recently merged with Leahy Health to become the second largest health system in Massachusetts.
The current issue that we're trying to solve at Beth Israel is the fact that they're still using pagers. While pagers were the standard in past generations due to their superior battery life and signal reliability, they have glaring issues when it comes to the daily workers of the healthcare industry. First off, they aren't HIPAA or the Healthcare Insurance Portability and Accountability Act compliant. Due to their lack of encryption or sign-in authentication, pagers cannot protect the information of their patients. HIPAA violations can result in fines of upwards of $650,000. Furthermore, Pagers simply have functionality issues. Compared to more modern devices, pagers are unable to reply to incoming messages or differentiate between the importance of those different messages. Pagers also don't allow you to send attachments or pictures, which means that doctors or nurses have to travel to each patient individually to get a gist of what's going on. This results in a major loss of time, especially for cases where they could answer a patient's questions with just a photo. However, replacing pagers at Beth Israel isn't so simple. While there are many alternatives to pagers, such as Mobile Heartbeat, a smartphone app, employees aren't so willing to use their personal device for work purposes. Their personal devices could also bring about an issue with battery life, privacy, and distractions. Because of this, we have a proposal of a standardized system to solve these issues.
For this project, our team is proposing that Beth Israel Deaconess Medical Center funds the purchase of 1,000 smartphones to be kept on site for the strict use of the Mobile Heartbeat application, as well as a brief, inexpensive training on proper use of the Mobile Heartbeat application and smartphone policy. For this lean implementation, our progress will be measured by saved hours and dollars that can be utilized elsewhere, as well as the anticipated change in employee satisfaction. Our scope for this project is the entirety of departments in the hospital, and our milestones are the initial implementation of the phones, as well as continuous check-ins.
This proposed lean project is estimated to cost approximately $1,474,500 in order to be implemented throughout the hospital. These costs include the perpetual license, annual maintenance costs, the cost of 1,000 iPhone 7s and charging racks, and the cost of professional services. On the other hand, return on investment calculations estimate that this project will save more than $750,000 and more than 300,000 hours after just the first year due to more efficient communication efforts, reduced waste throughout the hospital, and savings on overall communications infrastructure. Additionally, required resources for this lean project extend all over the hospital. First, people from a variety of departments, as well as all staff members in general, need to work together and be committed to the project in order to successfully implement Mobile Heartbeat. In addition, some required equipment includes the smartphones necessary to deploy Mobile Heartbeat, the charging racks used to store them, as well as the Mobile Heartbeat software application itself.
In order for continuous improvement to be made, Beth Israel must first keep track of the changes that Mobile Heartbeat brings to see how the change affects the productivity of their workers. It is expected that documentation and training sessions will be created in order for workers to get accustomed to authentication, managing patients, and passing off the phones. If the project proves to be successful in improving the productivity of the department, then the project should eventually be expanded to the entire hospital in hopes of creating a lean environment throughout the entire hospital.